this chart shows how significant difference there is in the sensitivities of our clinical evaluation tests, in this case, the median Tinel's and the Fallen sign, compared to the sensitivities of electromyography testing or musculoskeletal ultrasound and neuroultrasound. You see that time after time after time, test after test, the sensitivities of EMG testing and MSK ultrasound testing are significantly higher than those of just the clinical evaluation tests. And this is very important because, frankly, this is where you are able to differentiate and say, hey, I have total certainty that I'm not missing something. I'm not missing some patient who may have a pathology, and I am not identifying it because my studies are not sensitive enough. My physical examination tests are not sensitive enough. As a matter of fact, and I want to make that point in today's presentation, that actually a study that was published in Muscle and Nerve, they identified, and this is in medical offices, this is physicians' offices, they found that electrodiagnostic studies, EMG nerve conduction studies, they end up helping to change the patient diagnosis in 51.5% of the patients that they were tested. And another 46.5% confirmed the diagnosis of the physical examination testing. But that shows you that there is a significant more than half of the patients, their diagnosis changed because of the results of electrodiagnostic studies. So actually in 2020, we took this very study that was performed in physician practices, and we applied the study to physical therapy, to outpatient physical therapy practices. And we had quite a few patients. We had 462 patients, and this was a multi-center study across the country in several centers. The results were also striking. In the PT setting, close to 61% of the patients, their management was changed because of the result of EMG and nerve conduction studies. The actual diagnosis changed close to 39% of these patients, but also what was very valuable for us to see in this study is that more than 92% of the patients, they were reassured about their condition. About 90%, they were better able to understand their condition, and 90%, they were able to manage their condition better. So they saw a significant value with this testing. I mean, obviously, we want our patients to be able to manage their conditions better, to be able to participate in the management of their conditions in a better capacity. And this testing does prove to do that.